Something is happening inside your body right now that most doctors never warn you about. Not a disease, not a diagnosis. A slow, silent process that begins in your late 40s and, if left unaddressed, shapes almost every health outcome you will experience in your 60s, 70s, and beyond. It is not inevitable, it is not irreversible. But the conventional medical system has almost no framework for actually stopping it, because the framework it does have was built around managing decline, not reversing it. Every year that passes after the age of 45, your muscles lose a fraction of their mass, your arteries become slightly less flexible, your cells become slightly less efficient at producing energy, your joints accumulate more inflammatory damage, and your cognitive reserves quietly shrink. None of these processes announces itself with pain or obvious symptoms in the early stages. They accumulate silently, and then usually sometime in the late 50s or 60s, they start producing symptoms that your doctor gives names to: hypertension, sarcopenia, metabolic syndrome, osteoarthritis, mild cognitive impairment, and treats as separate problems requiring separate prescriptions. They are not separate problems, they are 5 expressions of the same underlying biological shift. And what the latest research published in journals including Nature Aging, Cell Metabolism, and the New England Journal of Medicine is now confirming is something that the most forward-thinking clinicians have suspected for years. Every one of these conditions responds meaningfully to the same category of biological intervention, not drugs, not surgery. The restoration of the conditions your body was designed to operate in. What doctors are now learning how to do, and what this video is going to show you, is how to reverse these 5 major age-related health issues using the mechanisms your body already has. Hi, I'm Dr. Alex. I'm an emergency medicine doctor, and after nearly 10 years working in the AAND, I've seen what happens when preventable age-related disease isn't prevented. I've stood at the bedside of patients in their late 60s dealing with complications, heart failure, fractures from falls, strokes that had their roots in biological processes that were already reversible a decade earlier. My goal now is to give people the information that the system didn't give them soon enough, so they can avoid those outcomes and live longer, healthier lives. If you're watching this video, you're probably noticing changes in your body that concern you, or you're watching someone you love deal with conditions that were supposed to be inevitable, somehow feel like they shouldn't be. And I want to make you a direct promise. I promise to keep creating the most rigorous research-grounded videos I possibly can, videos that go deeper than what a 10-minute GP appointment allows. All I ask in return is that you give this channel a real chance and hit the subscribe button right now. If you get to the end of this video and you genuinely feel you haven't learned anything new, please unsubscribe, no hard feelings at all. But if you give me your time and your full attention, I'll give you everything I have learned from a decade on the front line of medicine. Hit subscribe, help this channel reach more people like you, and let's get into it. Before we get into the 5 conditions and how to reverse them, we need to understand why they appear to be separate problems when they are not. Because if you understand the shared biology underneath all of them, the solutions stop feeling like 5 different battles and start feeling like one coherent strategy. The central driver of nearly every major age-related health decline is a combination of 3 converging biological shifts. The first is mitochondrial dysfunction, the gradual loss of efficiency in the tiny energy-producing units inside every cell in your body. Mitochondria are not just batteries, they regulate cellular repair, govern inflammatory signaling, and control how cells decide whether to regenerate or die. When mitochondrial function declines, which begins measurably in most people after the age of 40, it triggers a cascade that affects every tissue in the body simultaneously. Muscle cells lose their ability to contract efficiently. Arterial cells lose their ability to produce the signaling molecules that keep vessels flexible. Brain cells become more vulnerable to damage. Joint tissue becomes less capable of self-repair. The decline is systemic because the dysfunction is systemic. The second shift is chronic low-grade inflammation, a state that researchers now call inflammaging. This is not the acute inflammation that heals a wound or fights an infection. This is a persistent systemic, low-level immune activation that damages tissues over years rather than days. It is driven by visceral fat accumulation, disrupted gut bacteria, elevated blood sugar, poor sleep, and declining sex hormones, all of which accelerate after midlife. Research published in Nature Immunology has identified inflammaging as a root driver of cardiovascular disease, type 2 diabetes, sarcopenia, neurodegeneration, and osteoarthritis, not as a consequence of those conditions, but as a cause of them. The third shift is hormonal reconfiguration. After the age of 45, levels of testosterone, estrogen, growth hormone, and IGF-1, the quartet of anabolic hormones that maintain muscle, bone density, skin integrity, and metabolic rate, begin declining measurably. This is not just a reproductive change. These hormones are construction signals. They tell the body to build and repair. When they decline, the body begins spending more time breaking down than building up. And the 5 conditions we are about to discuss are among the most visible consequences of that shift. The conventional medical approach to these 5 conditions treats them as separate entities requiring separate interventions. A statin for cardiovascular risk, a bisphosphonate for bone density, a cognitive screening protocol for memory changes, a physiotherapy referral for joint pain, and perhaps a diabetes medication for metabolic dysfunction. Each of these interventions addresses an output, a measurable downstream number or symptom, while leaving the 3 upstream drivers we just discussed entirely unaddressed. What the evidence now shows is that intervening at the level of mitochondrial function, systemic inflammation, and hormonal signaling simultaneously produces improvements across all 5 conditions at once. This is not a theoretical model. Research published in Cell Metabolism demonstrated that structured interventions targeting all 3 upstream drivers produced measurable reversals in biological age markers across multiple organ systems within 12 weeks. That is the framework we are going to apply condition by condition. Words 1,800, 2,800, vertical bar, emotional peak, vertical bar, 20-25% of script. So let me take each of the 5 conditions in turn and name specifically and clearly what is actually driving it, because the conventional explanation you have probably been given is incomplete in every single case. The conventional explanation for age-related muscle loss is simple. You get older, you lose muscle, that is just what happens. The more complete explanation is that sarcopenia is driven primarily by 3 things: mitochondrial dysfunction in muscle cells that impairs their ability to generate energy and respond to training, signals declining anabolic hormone levels that reduce the body's capacity to synthesize new muscle protein, and chronic inflammation that actively accelerates muscle protein breakdown. These 3 factors create a net catabolic environment. The body tears down muscle faster than it rebuilds it. The critical word there is net, because if you shift that balance even modestly, the process reverses. Age-related cardiovascular decline is conventionally framed as arteries simply wearing out over time, becoming stiffer, less elastic, more prone to plaque. The more complete picture is that arterial stiffness is driven by chronic endothelial dysfunction, the failure of the thin layer of cells lining every artery in your body to produce adequate nitric oxide. Nitric oxide is the primary signaling molecule that keeps arteries flexible and dilated. When nitric oxide production drops, driven by insulin resistance, chronic inflammation, physical inactivity, and poor sleep, arteries stiffen, blood pressure rises, and the cardiovascular system begins to operate in a state of permanent elevated mechanical stress. This is not a structural problem that cannot be reversed. It is a signaling problem, and signaling problems respond to the right inputs. Metabolic dysfunction in midlife is almost universally framed as a consequence of eating too much and moving too little. The actual biology is more specific and more actionable than that. Insulin resistance, the core dysfunction behind weight gain, elevated blood sugar, and type 2 diabetes risk, develops when cells stop responding normally to insulin's signal to absorb glucose. This is driven not simply by caloric excess, but by the combination of mitochondrial dysfunction, reducing cellular energy efficiency, chronic inflammation, disrupting insulin receptor signaling, and visceral fat actively producing inflammatory cytokines that further impair insulin sensitivity. The result is a system trapped in its own feedback loop. Chronically elevated insulin drives more fat storage, which drives more inflammation, which drives more insulin resistance. Osteoarthritis is conventionally explained as cartilage wearing out, a mechanical problem with a mechanical cause. The biological reality is significantly more complex. Cartilage degeneration accelerates in midlife because the chondrocytes, the cells that maintain and repair cartilage tissue, experience exactly the same mitochondrial dysfunction, inflammatory burden, as every other cell in the aging body. Inflammaging, the chronic low-grade systemic inflammation we discussed earlier, actively upregulates the enzymes that break down cartilage matrix while simultaneously suppressing the repair signals that would normally maintain it. This means that joint degeneration in midlife is not purely mechanical. It has a strong inflammatory and cellular component that responds to systemic intervention. Age-related cognitive decline is perhaps the most feared of the 5 conditions, and the one most commonly presented as biologically inevitable. The actual drivers are the same 3 upstream factors. Mitochondrial dysfunction in neurons reduces their energy efficiency and makes them more vulnerable to damage. Chronic neuroinflammation, driven by the same systemic inflammatory state affecting every other tissue, accelerates the accumulation of the protein aggregates associated with neurodegeneration and declining blood flow, the brain, caused by the endothelial dysfunction we discussed in condition 2, reduces the oxygen and nutrient delivery that neurons depend on. Research published in Alzheimer's and Dementia has identified insulin resistance as one of the strongest modifiable risk factors for cognitive decline, to the point where some researchers now refer to Alzheimer's disease as type 3 diabetes. The brain is metabolically vulnerable in exactly the same ways as the heart and the muscle. If this is making sense and you want more content like it, please take 5 seconds and hit the subscribe button. It genuinely helps this channel reach more people who need to hear it. Now let's talk about what actually reverses these conditions. Before I give you the specific interventions, I want to frame this carefully. I am not suggesting you stop any medication without speaking to your doctor. I am not presenting any of this as a replacement for clinical care. What I am presenting is evidence-based information about the biological mechanisms that drive these 5 conditions and the interventions that address those mechanisms at their root. These work alongside medical treatment, not instead of it. The reversal strategy addresses all 3 upstream drivers simultaneously: mitochondrial dysfunction, chronic inflammation, and hormonal decline. The interventions are not exotic or expensive. They are biological inputs your body already has the machinery to respond to. The single most powerful intervention for reversing all 5 conditions simultaneously is structured resistance training. And the mechanism is not primarily about burning calories or building aesthetic muscle. When you place a progressive mechanical load on muscle tissue, a cascade of molecular signals is triggered that directly addresses mitochondrial dysfunction. The process, called mitochondrial biogenesis, produces new mitochondria inside muscle cells and improves the efficiency of existing ones. Research published in Cell Metabolism demonstrated that 12 weeks of progressive resistance training in adults over 65 produced measurable improvements in muscle mitochondrial function that were essentially indistinguishable from those seen in adults in their late 20s. The aging muscle, given the right stimulus, regenerates at the cellular level. Beyond muscle, resistance training simultaneously stimulates the release of the anabolic hormones testosterone, growth hormone, and IGF-1 that maintain bone density, cognitive function, and metabolic health. It improves insulin sensitivity through the same glucose transporter mechanism discussed earlier. And it significantly reduces systemic inflammatory markers, including IL-6 and TNF-alpha, the primary cytokines driving inflammaging. This is not a treatment for one of the 5 conditions. It is a systemic intervention that addresses the shared biology underneath all of them. 3 to 4 sessions per week of progressive resistance training, not casual walking, not gentle stretching, but genuinely progressive load on major muscle groups, is the most evidence-supported single intervention available for reversing age-related health decline. The dietary intervention with the strongest evidence base for reversing all 5 conditions is not a specific named diet. It is a set of nutritional principles that reduce inflammation and restore insulin sensitivity. The first principle is reducing ultra-processed food consumption as aggressively as possible. Ultra-processed foods, which now make up over 50% of caloric intake in most Western countries, drive insulin resistance, gut microbiome disruption, and systemic inflammation through multiple simultaneous mechanisms. Their removal from the diet alone produces measurable improvements in metabolic and inflammatory markers within weeks. The second principle is ensuring adequate protein intake, particularly in the context of supporting muscle protein synthesis. Research published in the American Journal of Clinical Nutrition has consistently shown that adults over 50 require significantly more dietary protein per kilogram of body weight than the current recommended dietary allowance accounts for closer to 1.6 to 2 grams per kilogram per day to maintain muscle mass and support repair processes. Most people in this age group are substantially under-eating protein, particularly at breakfast, which is the meal most critically associated with muscle protein synthesis timing. The third principle is increasing dietary diversity from whole food plant sources, not for ideological reasons, but because the diversity of plant-based fiber inputs is the primary determinant of gut microbiome diversity, which in turn directly governs systemic inflammatory tone. Research published in Cell Host and Microbe demonstrated that increasing dietary plant diversity produced significant microbiome improvements within 6 weeks, with corresponding reductions in inflammatory markers relevant to all 5 conditions. Sleep is not recovery from activity. Sleep is the primary biological window during which mitochondrial repair, inflammatory resolution, muscle protein synthesis, memory consolidation, and the clearance of toxic protein aggregates from the brain all occur. Chronically cutting sleep below 7 hours per night does not simply leave you tired, it measurably impairs every one of those processes. Research published in Science demonstrated that the brain's glymphatic system, the waste clearance mechanism that removes the protein aggregates associated with Alzheimer's disease, is almost entirely active only during deep sleep. Chronic sleep restriction does not just accumulate over time, it leaves behind biological damage in each of the systems relevant to the 5 conditions. Improving sleep quality and duration is therefore not a lifestyle preference. It is a primary clinical intervention for reversing age-related health decline. The most evidence-supported approaches are maintaining a consistent sleep and wake time 7 days a week, reducing light exposure in the 2 hours before sleep, keeping the sleeping environment cool, and addressing sleep apnoea, which is dramatically underdiagnosed in the 50-plus demographic and independently associated with cardiovascular deterioration, metabolic dysfunction, and cognitive decline. While resistance training addresses the muscular and metabolic dimensions of age-related decline, the cardiovascular and neurological dimensions respond most powerfully to what exercise physiologists call Zone 2 aerobic training, sustained aerobic exercise performed at a moderate intensity, roughly the level at which you can hold a conversation but feel you are genuinely working. Zone 2 training is the most effective stimulus for endothelial nitric oxide production, the primary mechanism reversing arterial stiffness, and for mitochondrial efficiency improvements in cardiac muscle. Research published in the European Heart Journal demonstrated that consistent Zone 2 training over 6 months produced significant reductions in arterial stiffness scores in adults over 60 changes that translated to measurable reductions in cardiovascular risk. 150 minutes per week of Zone 2 exercise combined with 3 to 4 resistance sessions is the combination with the strongest total evidence base for reversing all 5 age-related conditions simultaneously. I want to be direct. If you are on medication for any of the 5 conditions we have discussed, antihypertensives, statins, metformin, anti-inflammatory drugs, or cognitive support agents, The interventions in this section are not a reason to stop those medications without medical supervision. What they are is a reason to go back to your doctor in 3 to 6 months with improved biological markers and to have an honest conversation about whether your medication doses remain appropriate as your underlying biology improves. Many patients who address root cause drivers find that their medication needs change. That is a conversation your doctor should be part of. Let me bring this back to what I actually see in a clinical context, because I think real patient outcomes ground the physiology in a way that journal citations alone cannot. In emergency medicine, the patients I encounter who are dealing with acute complications of the 5 conditions, a hypertensive crisis, a diabetic emergency, a severe fall from muscle weakness, a cardiac event, almost universally have a preceding history of managed decline. Their numbers were controlled, their prescriptions were filled, their annual reviews reported that things were stable, but the underlying biology had been deteriorating throughout, because the underlying biology was never addressed. What I have seen repeatedly in patients who do change course, who commit to progressive resistance training, who genuinely overhaul their nutrition, who prioritize sleep with the same seriousness they give to medication, is a timeline of improvement that surprises them. Inflammatory markers begin shifting within 3 to 4 weeks. Insulin sensitivity markers improve measurably within 6 to 8 weeks. Blood pressure often responds within 2 to 3 months, sometimes allowing dose reductions in conversation with their GP. Muscle function improves within 4 to 6 weeks of consistent resistance training, with the subjective change in strength and energy often preceding the objective markers. The body's capacity to recover is far greater than the conventional framing of age-related decline suggests, because the conventional framing is built around what happens when the root causes left unaddressed indefinitely. The 5 conditions we cover today, muscle loss, cardiovascular deterioration, metabolic dysfunction, joint degeneration, and cognitive decline, are not separate diseases requiring 5 separate medical strategies. They are 5 downstream expressions of 3 upstream biological shifts: mitochondrial dysfunction, chronic inflammation, and hormonal reconfiguration. The convergence is not just an academic observation, it is clinically actionable. It means that the same set of biological inputs, progressive resistance training, anti-inflammatory nutrition, adequate protein, sleep prioritization, and zone 2 cardiovascular exercise addresses all 5 simultaneously through shared mechanisms that have been repeatedly demonstrated in peer-reviewed research. The reason most people do not receive this information from their doctor is not that their doctor is incompetent or indifferent. It is that the clinical system in which that doctor operates was built to treat disease presentations, not to systematically address the upstream biological drivers of age-related decline. A 10-minute appointment with a symptomatic patient does not allow for a conversation about mitochondrial biogenesis or the relationship between gut microbiome diversity and neuroinflammation. It allows for a symptom assessment, a prescription, and a follow-up date. Understanding the biology changes the conversation you can have with your own healthcare provider. It changes the questions you ask, the markers you request to be measured, and the interventions you are willing to take seriously. And that shift from passive recipient of managed decline to active participant in biological restoration is the real point of every video I make. The evidence is clear, the mechanisms are understood, the interventions are accessible. What has been missing for too many people is simply the information that is what I am here to provide.